Thank you, Mr. Chairman. And I want to start out by saying I appreciate Ranking Member Rogers' comments about working with us on various legislation, but I am concerned that we're holding a hearing on legislative efforts to lower health care costs at the same time that the Republican leadership prepares to bring Speaker McCarthy's what I consider irresponsible and extreme Default on America Act to the House floor. The Speaker's bill will raise costs for American families, kick millions of people off their health insurance, and cut $100 billion from the Medicaid program so they can provide huge new giveaways to billionaires and big corporations. Republicans are manufacturing a debt crisis to justify these cruel cuts. They're holding the American economy hostage. And this brinkmanship will be catastrophic to our economy and make it harder for American families to make ends meet. Republicans are also rushing the bill to the floor without holding any hearings or a markup. So much for regular order. Last Congress, when Democrats were in charge, we held several days of markups that included robust debates for both the American Rescue Plan and the Inflation Reduction Act. But now they're in charge, and Republicans are moving the Default on America Act without an open or transparent process, or any process at all, really. And we haven't had the opportunity to hear from experts about the bill's implications, probably because Republicans know how deeply unpopular these ideas are. So if Republicans succeed in cutting $100 billion from Medicaid, the consequences will be devastating and will be felt by every beneficiary, provider, and plan that relies on Medicaid. Republicans claim their bill would encourage Medicaid beneficiaries to work, but it's clear that this is just a pretext to cut Medicaid. As a reminder, the Congressional Budget Office found that Medicaid work requirements do not increase employment. They merely result in individuals losing coverage as a result of bureaucratic red tape. 2/3 of adults on Medicaid are already working, and those who are not generally have caregiver responsibilities, are dealing with physical or mental health issues that make work difficult, or are experiencing other barriers to unemployment like lack of education or training. If Republicans actually cared about increasing employment among Medicaid beneficiaries, they would have included policies to address those barriers. Now, turning to the topic of today's hearing, I do believe we should be working together to bring greater transparency and competition to our healthcare system, but I have some concerns about the process leading up to today's hearing. My Republican colleagues shared a vast majority of the discussion drafts we'll be discussing a week before the hearing was noticed. Given the broad array of topics and bills, I am disappointed that we did not have adequate time to fully vet some of these policies and provide the minority's input from the beginning. So I hope my Republican colleagues will commit to work in a bipartisan manner as we consider these policies moving forward. And I know that the Ranking Member Rogers has already said that she is committed to that. After all, we have been working together on H.R. 2691, the Transparent Price Act, which I introduced with Chair Rogers. Patients deserve greater transparency in the prices they pay for health care. Today, consumers are not able to easily obtain price information on healthcare services. Sometimes the price information that is provided is inaccurate and misleading, making it difficult to compare across providers or determine the true value of the care. And I know that we're going to work on that together. I just heard the Chairwoman Rogers say that. I'm also concerned by reports that many hospitals are either acting slowly or not yet complying with the hospital price transparency final rule, making it even more difficult for consumers to access price information. H.R. 2691 codifies the existing requirements for both hospitals and insurers, and it will also improve the accessibility and usability of the price information for consumers. I'm also pleased we're considering two bills that will increase transparency into pharmacy benefit manager practices by helping employers, consumers, and state Medicaid agencies better understand drug price information, which can help lower healthcare costs. We'll also discuss legislation that I support to cancel the $8 billion in cuts currently scheduled for federal payments to Medicaid disproportionate share hospitals, and a bill to require hospitals to disclose ownership data. Studies show that health consolidation is leading to higher care prices for consumers, and I'm particularly concerned about the role of private equity in hospital consolidation. I look forward to hearing from the witnesses on how these trends may be impacting healthcare affordability and access to coverage. So I look forward to the witnesses' testimony, and with that, Mr. Chairman, I yield back.